Welcome to This Explainer. Today, we're diving into some truly crucial medical data to help you manage your expectations when dealing with heavy menstrual bleeding. Look, if you or someone you know is navigating the often overwhelming world of gynecological treatments, making the right choice can feel, well, totally daunting. You want a solution, sure, but you also want to know exactly what your long-term future holds, and that's exactly what we're going to unpack today using a recent, highly detailed, systematic review.
Section 1. Dealing with heavy bleeding, the physical and emotional toll.
Let's kick things off with the reality of what brings patients to this medical crossroads in the first place. Heavy menstrual bleeding isn't just some minor inconvenience, it is a major medical issue that takes a massive physical and emotional toll on daily life. Just to put this into perspective, heavy menstrual bleeding affects around 30% of women of reproductive age in European countries alone. That statistic is absolutely vital because it validates a very specific shared patient experience. Honestly, if you're suffering from this, you are so far from alone. It's a highly common problem, which is exactly why the medical community has spent decades trying to figure out the best way to treat it.
Now, when looking for a cure, patients usually face a primary fork in the road. On one side, you've got a hysterectomy. And yes, a hysterectomy is a definitive cure for this benign problem, boasting a remarkably high success rate. But because it's a major operation, it carries risks of serious complications. And understandably, it's just not an option for women who wish to preserve their uterus. So on the other side of this comparison, many patients actively seek out less invasive alternatives. We're talking about options like oral medications, intrauterine systems, or specific surgical interventions that allow you to keep your uterus while actually stopping the bleeding.
Section 2. The endometrial ablation option, a less invasive alternative.
So, what is the most popular surgical alternative for stopping the bleeding without removing the uterus entirely? Well, that brings us to endometrial ablation. This is a minimally invasive surgical procedure specifically designed to destroy the endometrial tissue, which is the lining of the uterus, along with the superficial myometrium. By destroying the very tissue that's actively causing the excessive bleeding, the whole goal is to significantly reduce or completely stop the menstrual flow. Today, most doctors use what are called second-generation nonresectoscopic techniques, relying on disposable instruments to get the job done really quickly and efficiently.
The appeal of this procedure? It's completely obvious when you look at the immediate results. An impressive 85% of patients are initially satisfied with these modern ablation techniques. I mean, think about it. It's a faster recovery, it's less invasive, and right out of the gate, it seems to completely solve the problem for the vast majority of women.
But here's the catch, and honestly, the real reason we're looking at this data today. Despite that high initial satisfaction, a substantial part of these patients ultimately end up needing further surgery down the line. Previous studies have shown that anywhere from 17 to 34% of patients feel inadequately informed about the long-term failure rates and complications of their treatments. This creates a massive expectation gap. You go in thinking you're completely cured, only to find out years later that the fix wasn't nearly as permanent as you hoped.
Section 3. The need for reliable data, demystifying the statistics.
To bridge this expectation gap and really empower you as a patient, we have to turn to large-scale, undeniable data. We need to demystify the statistics so you know exactly what your long-term odds actually are. And the sheer rigor behind the data we're about to look at from a massive 2023 systematic review is incredible. Researchers didn't just look at one or two local clinics, they cast a massive net, identifying over 3,000 articles across major medical databases, and then strictly filtered those thousands of hits down to 53 high-quality, definitive studies.
Let's break down exactly what those 53 studies represent, because the sheer scale of this data is staggering. They tracked a total of 48,071 patients who underwent endometrial ablation between 1992 and 2017. And crucially, they didn't just check in to see how these women felt the next day. The follow-up durations ranged from a minimum of 12 months all the way up to a full 10 years of tracking. This gives us a rock-solid bedrock of truth that we can absolutely rely on.
Section 4. The 5-year hysterectomy risk, the creeping reality.
Okay, let's get right to the bottom line numbers regarding the actual surgical failure rate. If you get an ablation, what are the chances you're still going to need a hysterectomy later? Well, instead of an ablation being a permanent one-and-done fix, the data reveals this kind of creeping reality. At year 1, the risk of needing a hysterectomy is fairly low, at just 4.3%. But watch how it climbs. By year 2, it nearly doubles to 8%. By year 3, it crosses the 10% threshold. And by year 5, the risk of needing a definitive hysterectomy reaches 12.4%. The researchers point out that this steady increase might be linked to the regrowth of endometrial tissue over time, bringing back the bleeding. Essentially, your risk rises roughly 2% every single year.
When researchers mapped out the individual findings of all those studies, the upward trajectory was undeniable. It's fascinating because you can visually trace how that risk steadily and consistently increases as the months and years go by. It's not a sudden spike. It's a gradual, predictable climb over time.
And what if we look even further down the timeline, right past that 5-year mark? Well, the reality gets even starker. 2 studies in this systematic review actually managed to track patients for a full 10 years. At that 120-month mark, the mean hysterectomy rate climbs to 21.3%. Think about that. That means more than 1 in 5 women who opted for the less invasive ablation ultimately ended up requiring a hysterectomy within a decade.
Section 5. Does the device matter? Anticipating your medical anxieties. Now, as a patient doing your homework, you're naturally going to wonder if the specific device or brand your surgeon uses changes these odds. It's a really great question, and the researchers dug into it. Looking at the 5-year data comparing the different technologies, we do see some variations on paper. For instance, thermoballoon methods showed a 16.6% hysterectomy rate, microwave endometrial ablation sat at 10.3%, and radiofrequency ablation showed a lower 6.2% rate at that specific 5-year mark.
So, does this mean you need to stress out over which exact device your doctor uses? According to this comprehensive review, no. The researchers firmly concluded that while those numbers might look a bit different on paper, there are minimal clinically relevant differences between them once you factor in study sizes and variations. The overall scientific consensus is that the specific technology used doesn't meaningfully alter your overall risk. That upward trend, it's consistent regardless of the tool.
Section 6. Making an informed decision. Taking back control of your health.
So how do we take this massive, demystified dataset, tracking nearly 50,000 women, and apply it directly to your personal health journey? As the study authors write, providing realistic success and failure rates for endometrial ablation is crucial for their expectations and a well-informed decision-making process. That is the entire goal of this explainer: informed consent. We just want to make sure that you aren't caught off guard 3, 4, or 5 years after your procedure if the bleeding happens to return.
You now have the facts that used to just be buried deep in medical journals. The ultimate takeaway from this exhaustive review is crystal clear. There is a definitive 12% surgical failure rate within 5 years that you absolutely must factor into your choices. In fact, clinicians are now being actively urged to counsel their patients with this exact statistic so that expectations are properly set from day one.
Armed with this incredible data, we want to leave you with a critical question to take to your very next doctor's appointment. Knowing the long-term odds, knowing that 12% of women will need a hysterectomy within 5 years and over 21% within 10 years, is an ablation still your best first step? Now, for many people, the answer is still going to be a resounding yes, because it can provide years of relief without major surgery. But for others, knowing this might completely change their path. Take this knowledge, share it with your healthcare provider, and make the choice that is absolutely right for you.